Pharmacology is the science that deals with the knowledge and application of the drugs. It is a massive field that bridges physiology, chemistry, and medicine. It comprises two main branches, Pharmacokinetics and Pharmacodynamics. Clinical pharmacology applies these principles to humans, optimizing the safe and effective use of medicines to treat, prevent, or diagnose diseases. The aim of clinical pharmacology is to generate data for optimum use of drug. Pharmacokinetics. It is the study of movement of drugs in, through, and out of the body, or it is the response of body to the drug. It includes ADME, absorption, distribution, metabolism or biotransformation and elimination excretion. Pharmacodynamics. This includes physiological and biochemical effects of drugs and their mechanism of action at macromolecular subcellular organ system levels. Toxicology. It is the study of poisonous effect of drugs and other chemicals, household, environmental pollutant, industrial, agricultural, with emphasis on detection, prevention, and treatment of poisonings. It also includes the study of adverse effects of drugs, since the same substances can be a drug or a poison depending on the dose. Pharmacoepidemiology. It is the study of the uses and effects of drugs in well-defined populations. Pharmacoepidemiology is the bridge between both pharmacology and epidemiology, where pharmacology is the study of the effect of drugs on clinical humans. Epidemiology is the scientific study of the distribution, patterns, and determinants of health-related states or events in specific populations. Affinity. The measure of how tightly a drug binds to a receptor. Efficacy. The ability of drug, once bound to a receptor, to produce a maximum, Emax, functional response. Agonist. A substance drug that binds to a receptor and activates it to produce a biological response. Antagonist. A substance drug that binds to a receptor but prevents the action of an agonist. Bioavailability. The function of an administered dose of unchanged drug that reaches the systemic circulation. Half-life. The time required for the concentration of a drug in the body to decrease by 50%. Therapeutic index, a ratio comparing the toxic dose to the therapeutic dose. A high TI indicates higher safety. Steady state. It occurs when the rate of drug administration equals the rate of elimination, creating a stable, therapeutic plasma concentration. Tolerance. Decreased response to a drug over time, requiring higher doses for the same effect. First-pass effect. The rapid metabolism inactivation of an oral drug by the liver before it reaches systemic circulation. Side effects. A secondary, typically predictable effect of a drug that occurs at therapeutic doses. Adverse drug reaction. It is a harmful, unwanted response to a medication occurring at normal doses, ranging from mild rashes to fatal organ damage. Contraindication. It is a specific situation, such as a disease, age, or another medication, in which a drug should not be used because it may cause harmful, severe, or fatal reactions. Pharmacopeia. It is an official document of monograph for pharmaceutical substances and dosage forms specifying their physical properties, forms, purity, efficacy, safety parameter and analytical method for testing the specifications. Types of Pharmacopeia. United States Pharmacopeia, British Pharmacopeia, European Pharmacopeia, Indian Pharmacopeia, Japanese Pharmacopeia, Pharmacopeia of the People Republic of China. Pharmacotherapy. Pharmacotherapy is an application of pharmacological information together with knowledge of the disease for its prevention, mitigation, or cure. It involves selecting appropriate drugs to manage symptoms, cure or improve patient outcomes, including both prescription and over-the-counter medication management. Pharmacy. It is the art and science of compounding and dispensing or preparing suitable dosage forms for administration of drugs in man or animals. It includes collection, identification, purification, isolation, synthesis, standardization, and quality control of medicinal substances. The large-scale manufacture of drugs is called pharmaceutics. Chemotherapy. It deals with the effect of drugs upon microorganisms and parasites, living and multiplying in a living body, without damage to the host. It works by killing these cells or stopping their growth and division. Chemotherapy is often used to cure, control, or palliate various types of cancer, often in cycles. Posology. It is the branch of pharmacology which deals with doses of drugs. French posology, from Greek posos, how much. It involves determining the appropriate amount of a drug that should be administered to a patient to achieve the desired therapeutic effect.